Today we'll be introducing to you a monthly web series to educate you on spine health. We'll be talking about back problems, back pain, and different ways to treat them. We will talk to you about different ways of preventing injury and different ways to treat them if you have an injury. So I hope that you tune in and watch our web series and get educated about back health. Today we'll be talking about our first subject, which is back spasms. These are very common low back muscle spasms that patients get all the time. Usually occurs with minimal activity or it can occur from heavy lifting. The most common problem patients face is a low back spasm that is completely debilitating, very painful, very hard to move, and oftentimes patients can't move and they need to rest. The problem with back spasms is that it can be debilitating and very scary, and it is probably the #1 reasons patients show up in the emergency room on a yearly basis. The best thing to do is get evaluated, make sure it's not something more serious. Once we decide that it's only a spasm, it usually will get better over about a week or so with some medications and treatment. And usually what we do is have you come into the office or have you see your own primary physician and determine if it's not something more concerning. And if it isn't, then we start you on a treatment. That could be anti-inflammatories, warm compresses, physical therapy. But most of the time these resolve with a little bit of care and a little bit of time. But the most important thing to remember is that you have to get evaluated to make sure it's nothing more serious. And once we determine that it is only a muscle spasm, then we start treatment for that.